We are officially recording. So, all smiles. I am smiling. I promise. I am smiling. So, thank you all again for joining us on the virtual presentation Friday. This is a weekly meeting that we have with amazing speakers from all over the country and occasionally around the world that provide information and resources and just informing us of things that are going on around the world in regards to seniors and how we can better assist them and help them in the time that we're in. It is challenging times, but it is the reality that we're in. So I'm always glad to have amazing speakers on. And today's speaker will be a very good one, talking about telehealth and telemedicine, which I'm really excited about. But today, we are excited about our special and our amazing exclusive sponsor for today, Senior Well. So we're really, really glad that they were able to be our exclusive sponsor. So Shauna Brown, I'm going to let you take the wheel, and I'm going to mute myself.
Okay, well, good morning, everyone, and happy Friday. As Micah said, I'm Shauna with Senior Well, and on behalf of Senior Well, I want to share our excitement to be sponsoring today's virtual presentation with Dr. Watts. Some of my colleagues have also joined us for today's presentation from the many states we provide care. You may be asking yourself, who is Senior Well? Well, Senior Well, providing access to quality care is our priority. So we provide on-site audiology, dentistry, optometry, and podiatry to senior living communities, long-term care facilities, as well as day programs. So with the current focus on finding ways to limit exposure and deliver best possible care, we are your answer. We are currently in 13 states, servicing 855 communities. We have 56 providers, and in 2019 alone, we provided care to, drumroll, 154,000 patients. So I'm excited to share that because we've been busy. So you may be wondering what benefits we bring to our partners and the residents. Just to name a few, our focus is we provide a continuum of care. We are patient-centered care. We also are preventative in nature and offer telemedicine to help the nurse triage urgent type of care needs. We do remove transportation and internal logistic obstacles in getting residents to their off-site appointments. We also handle all the billing. We accept Medicare, Medicaid, private insurance, managed care, depending on where you are in the country and things like that. And we even take on the task of informing your residents and the families of our partnership and services and getting their consent for care. So we remove the time and financial burden that it can place on a community in doing that. So we're here to help. And if that already didn't intrigue you, we have a few big ahas that we offer as well. You know, for services, normally you would have 4 different people to call. With us, we're a single point of contact for all 4. One number, one email. We actually utilize a HIPAA compliant customer portal for 24/7 open communication between us. So you can access doctor notes, orders, recommendations, even the visit schedule. And lastly, we actually own and operate our own lab. So the third-party provider is removed, and we manufacture and fabricate glasses, dentures, as well as hearing aids. And the added bonus is that we also engrave all of those, so there's no more lost and found bugs. So, so my time's running out, and I know you're all eager to hear Dr. Watt's presentation as I am. So thank you, and have a wonderful rest of the day.
Thank you, Shauna. Thank you so much. So if you need to find out more about that, Shauna's information will be provided for after this call on the email that'll go out as well. So without further ado, who needs an introduction? We have our special guest speaker, Dr. Wilma Hunt Watts, and she will talk about telemedicine and how can telemedicine support healthcare and senior living communities pre and post pandemic. Give it up for Dr. Watts.
I cannot hear you guys, but I can see your beautiful faces. So thank you so much. Let me just click over onto the screen here. One second, sorry about the technical difficulties.
Can you get it?
Yep,
There it is.
there we go. A little bit of a glitch here. Hold on one second, I'm coming. All right, now you guys can see my screen. Well, it's Virtual Presentation Friday, and we're here to talk telemedicine. I'm your host, and they call me Dr. Wilma. So let's go back to the little girl who loved going to the doctor. There she is. This is my friend. She reminds me all the time of why I love medicine. So, an adventure I always look forward to was going and sitting in the doctor's office, waiting for the nurse to call me back into the examination room. I remember in the tongue blade or the tongue depressor, that little familiar pinch that the nurse gave my arm when she was getting ready to take my blood, stepping up on the scale to weigh me and to measure my height. Those are some great memories that I have as a child and what reminds me of why I love medicine. The next stop was going into the doctor's study. It was a really big room with large mahogany conference tables, and he would sit me when I was very, very little on his lap. I remember that cold feeling of the stethoscope on my skin as he made me sit very still so that he could listen to my heart and my lungs. Those are very pleasant thoughts that I had of being a child and going to the doctor. He would say, okay, Wilma, I'm going to give you a lollipop, bounce me on his lap, and the next thing I knew, I was so happy because I knew that this was the pinnacle of my day, seeing my doctor. Now, did I really just say that on a recorded line? Okay. In any case, after that, my mom and I would just leave the doctor's office and go back home across town on the bus. And those pleasant thoughts is what helped me, draw me into loving to practice medicine. So why are we here today? Well, we want to explore telemedicine's role in the senior living environment. We want to look at the legislative policies and changes. And we want to have a winning, successful telemedicine platform. That's what we want. Okay, what's the role of telemedicine in the senior living environment? And I'm sure you guys won't mind. I have some notes here because I want to make sure I get everything right when I'm delivering this message to you. So just, if you hear some papers crumbling, don't worry about it, okay? It's just me going over my notes, making sure I don't miss a beat. I'm going to assume that a large portion of today's attendees have a vested interest in the senior living space, which by definition makes you a stakeholder. Classic definition of a stakeholder: any person or party with an interest in the financing, implementation, or outcome of a service. That makes us all very, very important stakeholders. Telemedicine as a tool has the potential to empower stakeholders within the senior living community by adding another tool to the care model, and also by reducing healthcare costs, keeping loved ones connected via teleconferencing, and minimizing the risks of exposure to infection. Now, this is one of the most important slides I want you to remember. Remember this slide. The most important stakeholder in the healthcare system is the patient. So as stakeholders, let's stop looking at the patient as a potential financial asset to our broken healthcare system. From birth till the time we leave this planet, we are a part of the healthcare system in one form or another. Remembering that one simple nugget will make your job a lot easier. And if anyone can relate to what I'm saying, just wave your hand. I just want to say, can you relate to that? Thank you. I knew that I had a really smart group here. I love practicing medicine because I love helping people. For over 20 years, I've devoted a lot of my energies to the operating room, assisted living facilities, skilled nursing facilities, numerous home care visits. I've always had an affinity to the elderly because if you listen to your patients, they can teach you a lot about life. After years of running a private practice, doing numerous house calls, performing surgeries, teaching residents, I was introduced to the world of telemedicine. And it was love at first sight. At the VA, telemedicine gave me the ability to examine a lot of patients from multiple states, all at the same time, all in one day, a virtual house call over the internet. The Department of Veterans Affairs had introduced me to a dream position where I could serve our nation's veterans with the newest technology. And as the daughter of an Army veteran, this made me proud. So what is telemedicine? The use of medical information exchanged from one site to another, using electronic communications to improve a patient's clinical health status. Telemedicine includes a growing variety of applications and services using two-way video, email, smartphones, wireless tools, and other forms of telecommunications technology. However, if you want to get technical, telemedicine is really a subset of telehealth, whereas telehealth is a broad term, which includes health services like teleradiology, teledermatology, telepsychiatry. Don't get it confused. Telehealth and telemedicine is used interchangeably in a lot of instances. Another term I want you to remember is teleconferencing. This is when you have an interaction between multiple users across various sites with the interaction of electronic transmission. This involves transfer of video and audio through computer and video systems. And the interaction is usually live, mostly used in the diagnosis or monitoring a patient like in home care. Now that we have a working definition of telemedicine, let's look at the different types. Telemedicine in real time is referred to as synchronous telemedicine. That's when you have, on the telephone, you have real-time parties communicating. You also have video conferencing and video chat. And the next type of telemedicine, start forward, which is also considered asynchronous. This is when providers review images, like in radiology, when they're looking at x-rays, lab results, charts, secure email, and private patient data when they're talking to another specialist. Remote patient monitoring is something that hit the scene in January of 2018 when Medicare finally approved their first code, 99109, where you have telemonitoring of the health status of a patient from a distance, like in home care. One of the emerging types of telemedicine is chatbot or artificial intelligence. And I want to share this video with you from my friend, Dr. Mei Chen. Why did that happen? Excuse me one second. I want to share this video with you. This has to do with the chatbot, which I don't know if many of you have seen, but it's a very exciting format in telemedicine. Can't hear? Okay, so can't hear. Okay, well, the chatbot really, I'm just going to tell you how exciting it is. It's something that you can get at home for your home care patients, where it describes to the patient, they pick up the phone. Like that example of the chatbot was a post-surgery patient, which I do a lot of surgery, so that's why I'm very interested in it. It tells the patient or asks the patient different questions, and that information, as the patient responds to the question, is transferred to the doctor or the healthcare provider. So I'm sorry that the video is not working, but you know something, next time we'll try and look at, see what the chatbot does. Okay, so now, telemedicine capable devices. There are all different types of ways that we can use telemedicine, either through your tablet, your cell phone, or your computer. In my opinion, there's no reason why in the senior living environment, we should not be using telemedicine. But there are reasons why they're not using it, which I'm going to show you later. So you're probably saying, so how can I help? One of the authors that I like to read, he says, if telemedicine could help older patients stay out of the hospital, why hasn't it taken off? This question has been proposed in many instances by many different people. Telemedicine really is great, but why hasn't it taken off? I'm going to give you a few scenarios. We have a patient in the assisted living environment. He's a 79-year-old male residing in the community, and he's been experiencing chest pain over the last 48 hours. Mr. Joe is his name. He doesn't drive, and he doesn't like going to the doctor. He mentions the chest pain to one of his care coordinators. The care coordinator, what does she do? She calls 911 immediately. The patient is transferred to the hospital. They perform examinations on him. They run tests, which reveal acute findings. And the patient has little face-to-face interaction with the provider. So now the resident is discharged from the ER, told to follow up in outpatient cardiology for a stress test, and had to take a cab back to his apartment. So now what happens with the patient? He incurs an ambulance charge because he went to the ER. So he gets that charge. He gets an ER visit charge, a physician charge, and transportation costs, all because he didn't meet the criteria to be admitted. This is how telemedicine can save us. So let's look at the patient, the same patient, Mr. Joe, in the assisted living environment. So he complains about chest pain, and he notifies the nurse. The nurse calls the on-call provider. This assisted living facility uses a telehospitalist. The telehospitalist evaluates the patient with telemedicine technology, gathers the history, performs the exam, runs an EKG, and reads it in real time. The telehospitalist is able to listen to the patient with a digital stethoscope. The telehospitalist suspects and creates the treatment plan while the patient remains in the community. I don't know about you, but I know that familiarity has a lot to do with a patient's health. When this patient does not have to go into the ED, I think long-term effects are going to be better for this patient. So, one thing I want you to remember, it's been observed that when a patient goes to the ED, they can experience disorientation in the ED, their drug lists and their care instructions can get lost. The beeping monitors in the hospital, really upsets the patient when they're trying to rest. And you're also experiencing an exposure to increased infections whenever you go out of your environment into another environment like the emergency room department. And research has suggested that 2/3 of hospital admissions from nursing homes were potentially avoidable. In many cases, a video visit could make more sense. But there are a few business models employing virtual care because payers don't cover it. That's something we all need to remember when we're treating our patients. So these are the case studies that we mentioned. This is in reference to the case studies that I mentioned. Disorientation in the emergency room. I don't know how many of you have ever had to go to the emergency department, but for a senior, this can be a little traumatizing. And especially when nobody in the emergency room knows what this patient's drugs are, what drug list they have. And being in a different environment just completely upsets the patient. So how do we strengthen our telemedicine platform? Number one, we should understand the benefits of telemedicine. We want to embrace this life-saving technology, and using the technology when it's appropriate and warranted is how we're going to help strengthen this telemedicine platform. Telemedicine has been around for a while. We've had a lot of pros and cons of telemedicine discussed by different people, different institutions. Some of the pros, the convenience of it, specialist accessibility, especially if you're out in a rural area where you cannot get to a specialist, that's been a pro for telemedicine. The cost savings, just imagine you have a senior who has to get in their car, they have to park, they have to go into the hospital, pay for parking. This is a cost savings for that patient. And increased care continuity. When you use telemedicine, you're able to talk to your practitioner and keep that care continuity going. Some of the cons of telemedicine have been that you require technical training and you need special equipment. The decreased reimbursement has been something that has been holding telemedicine back. Limited use cases because you can't use telemedicine for everything. And the lack of interest by the stakeholders, I should say. That has been, I'm going to say, probably the number one thing that has been holding telemedicine back. So, with the arrival of COVID, what did we have? Don't you like my little COVID? I like that little COVID thing. We're gonna beat this thing. We are gonna beat it, watch and see. We had our stay-at-home orders, our social distancing recommendations, decreased access to our healthcare providers and institutions, and reduced emergency department access. This is where we are with COVID. So we've discussed those things pre-COVID, the restrictive legislation. That's another thing that has been holding us back. And now with COVID, the legislation has been relaxed. This has been a big thing. Because our Congress and the administration has put things in place, this is why COVID has completely exploded. The reduced reimbursement and coverage pre-COVID has held telemedicine back. Now we have increased reimbursement and coverage. The strict HIPAA compliance pre-COVID has also been a really huge thing. Now our state licensing laws have been relaxed, where you can see a patient in one state and be in another state. A lot of providers are totally liking this because it helps us have access, like I do at the VA, to patients in different states. So, how did legislation make a big effect on telemedicine? We're going to start with the beginning of COVID. On March 13th, President Trump, he made an emergency declaration under the Stafford Act and the National Emergencies Act, empowering CMS, Centers for Medicare and Medicaid, to issue waivers to the Medicare program requirements to support healthcare providers and patients during COVID. One of the first actions CMS took, which I thought was probably one of the best things they could have ever done, under the authority to expand Medicare on March 17th, was allowing beneficiaries to receive telehealth in any location, including their homes. One thing that providers were having a hard time with was the originating site of telemedicine. A lot of patients could not use their homes as an originating site, so they did not have access to telemedicine. The administration also removed barriers that limited beneficiary telehealth services. Pre-COVID, you needed interactive audio, video technology was required for a telehealth visit. And that was a challenge to beneficiaries when they didn't have access to the technology, or if the doctor offered it to them, they didn't want to use it. So with the Department of Health and Human Services and the Office of Civil Rights, they announced they would exercise enforcement discretion and waive penalties for HIPAA violations against healthcare providers that serve patients in good faith through everyday communications. So that meant that you could use FaceTime and you could use Skype. That was a big thing for telehealth. Big move, because that opened the access to a lot more patients that didn't have technologies with other means. Soon after, CMS went further to eliminate these barriers for paying for certain telephone evaluations and engagement visits and behavioral health services. And in addition, the patients were able to, the doctors did not have to collect the co-payments for their patients. So that was also a big thing. And then the 116th Congress passed HR 6201, the Families First Coronavirus Response Act. This was the biggest thing Congress could do because this is when telehealth exploded. So, what is the future of telemedicine now? Now that COVID has spurred interest in telehealth, given us access to telehealth, telehealth grew wildly during COVID. And now visits are plunging and providers and institutions are having to recalibrate. We may look back at COVID-19 as the tipping point in the global adoption of telemedicine. With increased usage of telemedicine, there's no chance for, there is a chance for increased fraud and a lot of bad actors. One thing that I did notice is that when telehealth exploded, you started seeing a lot of different companies pop up saying that they were offering telemedicine services. And this is something as stakeholders, we're going to have to be very careful of and watch out for. So as stakeholders, we can now take a position post-COVID. And the time to act is now. We want a well-defined virtual health roadmap. And this is where we all need to start looking. We need to develop a good roadmap, optimize provider networks, and accelerate value-based contracting to incentivize telehealth, build virtual health into new product designs, integrate virtual health into care delivery approach, and reinforce the technology and analytics foundation. The window to act is now. We have a $3 billion revenue market in telehealth, and they're saying that it has the potential to grow to $250 billion. Some of the key takeaways are seniors and others in the healthcare system want to maintain their independence. And I think we all want to maintain our independence for as long as humanly possible. And telemedicine is one of those tools we can use to make that possible. Empowering the most important stakeholder in our healthcare system, which is the patient, inevitably strengthens the system overall. And with telemedicine, we have that golden opportunity. Telemedicine is commonly referred to as the democratization of healthcare. All the tools to integrate virtual care into our care delivery model are at our disposal and ready to be implemented. If you're ready to make that transition, which you do now or you do later, because it's going to happen. So why not position yourself now? COVID-19 taught us one thing: get prepared, and get prepared now. This is my contact information, and I thank you. Please excuse my little nervousness, okay? But this telemedicine is something that I truly love. I love practicing medicine, and I love being able to help people. And telemedicine affords me that opportunity. So you can feel free to reach out to me. You have my email address, my website, and a phone number. And I want to thank you for your time and attention. And most important, I want to thank our sponsors for today's talk. And most important, or I should say at the very top of the list, is Micah. Thank you for the opportunity. I appreciate it tremendously.
Thank you, Dr. Watts. So those that are muted, just want to, sign language clap here. Dr. Watts, if you could stop sharing, and then if you could share those links with me today, and then I'll send that in my link for the email that I'll send out after this call.
Absolutely.
So everybody, you're funny, Peter. So everybody will get the link and everything for the resources that she just shared, and I'll send her contact info as well for this call. So as you all know, completion of a presentation, especially one as profound as that, the good and the bad. Does anybody have any questions? Please raise your hand. Those that are sharing your screen so we can actually see you. Feel free to ask any questions. Otherwise, you can also chat if you'd like. There was one comment that was made by Evelyn. Nearly 20% of older adults live in rural communities where access to practitioners is reduced in comparison to urban counterparts. Telemedicine can offer great access to medical treatment and sharing vital signs, anxiety levels, et cetera, et cetera. So, that's really good information. Thank you, Evelyn. Does anybody else have any questions? Please, this is your chance to ask away.
Please,
you have
ask
a doctor.
questions.
You have a doctor at your disposal right now, and for free. That's usually not always the case. I'm just being funny. Come on now, have a smile.
The thing I have to say, I'm sorry, Micah, that I feel very privileged to be able to deliver telemedicine and having been a patient in the past. That's when you really learn to appreciate our healthcare system. Okay, and this is why I think telemedicine is going to really help a lot of people in the healthcare system.
Very true. Evelyn said again, telemed is so important. How can the devices be distributed to patients?
Okay, Evelyn, ask that question again.
How can the devices be distributed to patients?
Okay, depends on where the patient is. Okay, if the patient is at home, then that's a whole different situation. But if the patient is in an assisted living environment or a skilled nursing facility, then the facilities would probably, and this is why I like being an ambassador for telemedicine. We need to get in contact with some of the facilities so that they can get some of these, some of the equipment to distribute to their patients. Because like I mentioned before, I ran into a facility, they had the equipment, but they weren't using it. And that's why it's important for us to embrace this technology. You have to use it.
Very true. And then Carrie Jackson asked, do you think we will start seeing more of this in assisted living in the future?
I do. All of the statistics are pointing in that direction. I highly believe that we are going to start seeing more of it in this, because the other thing is that when a patient leaves a facility, sometimes the facility is penalized because the patient is out, or if they have readmissions, that is another thing that facilities get penalized for. So I do believe that we're going to start to see a lot of it, especially with COVID around, because we want to reduce that risk of infection.
Somebody wants me to do a poll and raise your hands. How many of you are using or have used telemedicine or telehealth?
I'm curious to see that too.
Okay, Ty, Cheryl, Michael, Karen, Carrie, Sheila raised her hand. I don't know if that was raising your hand because you're, and then Joe Coleman. So quite a few apparently have it and have used it. Sheila, I don't know if you're asking a question because you're raising your hand. You can go ahead if you're raising your hand to ask a question. Go ahead. Or was it more to, as you were saying, that you used telemedicine, telehealth? Okay, I'll lower it for you. Okay, she did. Okay, and then Alexa and then Rachel have used it as well. And then Julie Bingham had a question: how do we get therapies such as SLP offered via telemedicine, telehealth?
SLP?
Julie, can you explain SLP? Because I'm not familiar with it. There's still much resistance from the corporate level. So I'm guessing senior living, I don't know, I'll have her chat that. And then Lori Henley, we are approaching 200 visits since COVID at Grand Oaks in DC. SLP, speech language pathology.
Oh, okay. I do want to mention there are some companies out here, private companies, and I'm going to warn everyone to be careful the company that you use. Telehealth Solutions, Dr. Wasim Danab, he is a very close friend of mine, and he is across the United States. And I like the model that he's using to help in different facilities. So if you want to have access to telemedicine without having your own device, you can sign up with a lot of different companies to get their telemedicine services. But you do need to be very careful, because there are some bad actors that all of a sudden have come out of the woodwork offering telemedicine services. So you have to do your due diligence.
So I'm going to rephrase the question now that I know what SLP stands for. So how do we get therapies such as speech language pathology offered via telemedicine, telehealth?
And is this in an assisted living facility?
I'll wait for her to chat or nod her head.
Yeah, I'm curious, like where would we need the telemedicine service?
Don't see her on here. I'll wait. CCRC. So life care community, something like that. Continuing care retirement community.
I'm going to say that if she would shoot me an email so that we could look that up, and I could probably connect her with the right person that offers that kind of services, because I'm also a member of the American Telemedicine Association, and they have a lot of resources where we could find out where that service could be offered.
Okay. And then I had another question. What is available for patients in remote areas where reception is poor?
That is a huge thing. Because of legislation, we need broadband in rural areas, like really bad. And I've been on Capitol Hill with the ATA on a number of occasions trying to get that legislation passed so that we can expand broadband. It is an issue. And I'm not going to lie to you, it's a problem. And until we get our legislators to pass the laws for broadband, getting telemedicine into rural areas is a problem.
And then, does anyone know what the percentage of senior living communities across the country are using telemed already? And what level? Independent, assisted living, skilled? That was the question, I guess, not just for you, Dr. Watts, but just as a blanket question of does anybody know that statistic? Because I don't know that number.
Not sure, but I could find out through the American Telemedicine Association. And if you want to just shoot me an email, please connect with me so that I can get that answer for you.
Okay. And then Ty, Visiting Angels Charlottesville offers teledoc for free to their clients that are over 30 hours a week home care services. They rolled that out new teleservices bundle for COVID. So some people are taking advantage of that program because of this. So does anybody else have any other questions? These are great questions. I mean,
I know. Thank
you guys are really putting her on the spot. I'm loving it.
That's okay. That's why I'm here. I'm on the hot seat.
Put her on the hot seat.
Oh, I have a question.
Go ahead, Marcia.
Yes, hi. I tried to text it in the chat, but it wouldn't go through. I don't know what's happening. I did it twice. Anyway, I own a home care agency in the town of Warrenton, Fauquier County. It is a rural area. And the home care, how do you see it working in home care? Recently, I had a gentleman out of Winston-Salem who is putting telemed in home care agencies. Oh. And he is looking to do an acquisition and put telemed in. So I was, I've been in home care. I'm a nurse. I've had my agency for 20 plus years. Okay. Right in my town. So I was like, it's sparking my interest.
Yes,
okay?
It should.
Yeah.
It should.
Yeah. So how do you see it working in a home care agency?
Well, I'm going to say that thank God that Medicare has now passed a lot of codes, a lot of the CPT codes for home care where you can do the remote patient monitoring. That is key because the insurance companies are reimbursing for that. So with the home care agencies, you can do remote patient monitoring so you can monitor your hypertensive patients, your diabetics. I definitely see a connection there that is going to be very successful because Medicare is now allowing those visits.
Okay. Now I'm a private agency. I don't have Medicare or Medicaid clients for a reason many years ago. So, but anyway, the whole thing is between the client and us.
Then that's where the out-of-pocket cost is probably going to come in. Or I think one good solution to that problem would be to connect with a telemedicine company, and I have one in mind.
Okay.
If you would message me, that they would be able to offer the service to your patients.
Hey, that's great. That's great.
If you don't mind.
Yeah, I am interested, and I'll provide my email. I had to leave. I didn't get your email. So
Michael has everything. He'll have everything.
You'll have it. You'll have it.
So much. Thank you.
And then real quick, somebody did some quick finger searching. Zandy said that Senior Housing News recently found that 33% of communities plan on increasing investment in 2020 and 2021 as a result of 2019.
There you go.
So
exactly.
It's happening, and it's going to come. It's going to be the next normal, whatever that's going to be.
Yeah. And it's to our benefit to get ahead of the ball.
Yeah, because unfortunately, who knows what the future is going to hold with viruses and everything else that's coming. So it's a new challenge.
I have a friend in the Philippines where she uses telemedicine through helicopters because they get a lot of, I guess, bad rain, you know? So yeah, and so telemedicine, you can use it in a lot of different venues if you want to, but it's really gonna take off.
That's awesome. Thank you for that. I'm going to do one more round. Does anybody have any questions?
Micah,
Yep.
one question. How would you recommend approaching for clients? I'm in home care. We have private pay clients that have local doctors that they would like. How would you recommend as a marketer approaching their PCP and connecting or setting up telehealth for them that maybe they don't offer that? And I guess the benefits from a doctor's perspective.
Yeah, I'm glad you asked that question, Kai. Thank you for your question. I'm going to tell you that the number one issue is adoption by some of the doctors. Doctors are funny. They don't like to change. They want to do the same thing over and over again. And I'm finding a number because I have a lot of friends that are doctors. My first husband, the doctor, and when I talk to him about doing telemedicine, he's like, oh no, I don't want, look, we have to do this. And if they don't see a bottom line to it, and that's why I say, stop looking at the patient, the number one stakeholder in the healthcare system, as your money source. Okay, we're here to deliver a service, you know, and that's what we should be trying to do. But me trying to convince some of these doctors, and in response to your question, how do we convince them? It's going to be hard, but if they don't change is going to happen around them. So I don't know what to tell these doctors that don't want to change, but they really need to try and get on the bandwagon because it's going to happen one way or another. And I hope I answered your question. And I'm sorry I don't have a more direct response of how to change the doctors' minds, because it seems to me when I talk to patients, they want to use the service. They want to understand it. They want to have access to it. But a lot of doctors, they say, oh, it's a waste of time. I don't want to do it. Or you can't do that through a video conferencing, you know, and that's why you have to have a doctor like myself. I'm very comfortable trying to treat my patients through video conferencing. And I think it has to do with the fact that you have a good number of years, I've seen a lot, and you kind of know your patients. That's where that comfort level comes in. And
I see.
Yeah.
Awesome. Thank you.
You're welcome. Thank you for your question.
Well, I'm going to, go ahead, Cheryl Slavinsky.
Thank you for that answer. I was curious about if anybody else had other barriers to why, you know, you're in a facility, everybody wants it, or think they want it maybe. What are the barriers? I hadn't even thought about doctors. Because I was thinking maybe it's staff. It's like, oh, it's one more thing we have to learn or whatever. I don't know. I'm just asking that question about other barriers. To anybody in the audience. Anybody that's maybe implemented it already?
Somebody here answer Cheryl, because I think it would be a good perspective. Somebody has a facility where they have telemedicine and it's not being implemented. That's a good.
Yeah, somebody said that. That was interesting.
Mm-hmm.
Not that I'm seeing in the chat. The only thing that I see in the chat is many facilities don't have the computer infrastructure. And then somebody else said reimbursement and HIPAA fears. And then Joe Coleman, you just came off mute, so I'm gathering you're gonna put in something.
It's kind of a minor issue in the grand scheme of things, but we first started using it for psychiatric services, which really worked well with some people. But if you're already a paranoid schizophrenic and we've got the television off in your room because that causes issues with your condition, talking to a doctor on an iPad was really, really crazy and weird, and did not work for some people.
Interesting. Thank you.
Anybody else want to chime in?
Cheryl,
Okay. Go ahead.
I was going to just say something to Cheryl. Another thing that I've noticed in some facilities is that the equipment would be on site, somewhere and nobody knows. So you have to have continual training on it. And the number one thing, you have to have buy-in from the top down. And if the big guy up top is not pushing it, and then it's not going to work. And I don't know if anybody else has experienced that, because I've seen that in too many facilities.
Thank you.
And then I had, oh, go ahead, Cheryl, go ahead.
No, I'm just thanking her because I have a new job now. I'm vice president of national physiatry. So, and we're using telehealth. Another thing that was not reimbursable before, and because of COVID now, a physiatrist, which is a medical doctor of rehab, we can do telehealth. And so, and take care of the social distancing and everything. So, it would be my job to find communities that would want to accept this. And so I'm still at the research point where I'm looking into, what are the barriers? And you've mentioned some. I kind of figured you got to start at the top because, you start at the bottom. I think everybody sort of is out of time right now. So everybody's like, oh my gosh, it's one more thing. But once people have this, and have maybe a physiatrist on site or any, it's not even just that. Once they have it, people won't be without it. And I think you're right. I think it's going to be here whether people want it or not. And the early adopters are going to be the winners as far as differentiation of services.
That's what the literature's saying too. Thank you, Cheryl, for that comment.
Thank you.
Then somebody chatted that they're in an affordable senior housing. One thing that they have come up against is residents who are hearing impaired and can't hear on the iPad, even with headphones. So what are some suggestions or advice on that, kind of thing? Yeah, I see you, Joe. Joe's like type away. Is that
We need to get
another
sound?
Is that probably the only best way to handle it is just they're gonna have to type away and chat that information between doctors and
That's what I've seen. Yeah, when the hearing has been impaired, they just have to communicate via typing.
Okay, I hope that answers that person's question. Does anybody else have any other questions? This has been good. I mean, wow, you've been hit with some really heavy questions for sure.
I like it. Thank you. This is why I'm here.
I'm gonna go once, twice, and I'm gonna stop recording.